episode, ladies and gentlemen. Doctors Unhinged. Not with Dr. Michael today, but with the very interesting guest, Mr. Sokola Mr.
Yes.
Let me not take anything away. I will let you introduce yourself. Tell us about yourself, sir.
All right. Thank you so much, man. My name is Sekgola Mesetlhare. I'm a nurse. I've worked mostly in the pediatric inpatient and the emergency department. Over a clinical career of about 8 years. I also have like a background of working on global health programs that are just targeted on capacitating healthcare providers on emergency cardiovascular care training. So I have led and coordinated a lot of these programs, both here locally in Botswana, Tanzania, South Africa, Ghana. That's a lot of what I've been doing. But currently a lot of also our core work now is around really trying to capacitate the community around emergency care, trying to capacitate them with the life-saving skills of, what happens when someone gets into an emergency, especially cardiac emergencies outside the hospital. So we're really trying to help them get this knowledge. I guess in a way also trying to help the healthcare system. I guess the healthcare system in this context, I mean healthcare providers and their health facilities.
Right.
But I think a healthcare system is actually goes beyond healthcare providers and facilities. So if you look at a lot of the emergencies happen outside the hospital.
That's very true.
Right? And if you look at our infrastructure resources, healthcare providers hardly ever get to incidents on time.
I remember, I'm going to get it, don't worry.
Yeah.
I think I had seen an interview of yours. It might have been the BTV one.
No, I think it was on. It was with Kathy Malijan on NHF podcast.
I think you mentioned that the window we need is 15 minutes, right, for the ambulance and the paramedics to get there.
That was actually like the desired response time our public EMS have set themselves. But they hardly ever get there within that 15 minutes. So imagine if someone is maybe in a cardiac arrest, you have like a window of 10 minutes or even less for something to be done. So we'll never get there on time. So we are trying to involve the community to help us with a lot of these emergencies. And the only way for them to do that, if they have some form of basic knowledge around most of these emergencies that happen outside the hospital. So we are really targeting the community now because we have like really amazing training programs specifically for the community so that they help us. What do they do? Because most of the time there's a passerby, a family member, basically a bystander. Yeah. Right? And if they don't know what to do, they're just going to call EMS, which is going to get there late, not really to save, in most cases, just to certify death, and we're really just trying to change that and show the community that they can actually get involved and help us for better outcomes.
It's a very beautiful passion and dream. I had the pleasure of being under you for the BLS training that we did last year. And I think in general, my attention span isn't the greatest. Like my mind, like after 15 minutes, it's just wandering off, right? And I can specifically remember, I think when we did that session, I was probably as engaged as I have been for a very long time. I don't know if it's your approach to it or it's the passion, but you make it so simple. And I was thinking to myself, this is information that the general population should have. Simple things like just turning the patient to the side could be something that's life-saving versus waiting on the paramedics to come through. Is there what drives you? What's your passion behind this?
Yes, it's there's a lot of passion behind what I do. Like I told you earlier, I've worked most of my clinical career. I worked in the pediatric ward. Right. So I was taking care of like really critically ill kids. So where I was, the hospital that I was in, Scottish Livingston Hospital, it's out in Molapolole. during my time there, we had a lot of diarrheal outbreaks. We saw a lot of pneumonia, cases. So, in a nutshell, I saw a lot of kids die in my hands under my watch. It's not pretty.
No, it's not.
Yeah, and you lose a kid, you look at the mother.
Esh.
It's you'd see someone literally lose their mind, literally lose their mind. You just tell them, we couldn't save your child, and instantly they sort of they don't know where they are, what is happening, because of the shock and the pain. So it was just a mess, and when as time went by, fortunately I was exposed to certain child survival training programs that eventually came to our district, and that actually showed me why we are losing those kids. And it was just ridiculous.
Yeah.
Like simple stuff, but we just didn't know.
Yeah.
We just didn't know. And once I saw that, I just wanted to. That's what made me fall in love with, if this is the reason why we've been losing these kids, this shouldn't happen.
It shouldn't. It really shouldn't.
I guess that's where really my passion for survival, started. And it started off with child survival, but I think
it evolved.
Eventually just evolved into everyone who is not supposed to die should not die.
Yeah.
If there's something that we could have done to avoid that death, then they should not die. So I guess that's really where all this passion came from. That painful experience during my time in the pediatric ward. So if it were up to me, no child should be dying. To be honest, especially due to some of these reasons that I see here locally.
I think anyone that's been on the ground can testify with how heartbreaking it is. And I mean, if anybody hasn't said it, personally, I just want to say thank you for pushing the drive and for your service and really trying to drive the narrative that there's more that everybody can do.
Absolutely. No, thank you, man. I'm hoping with platforms like yours, we can just keep on putting out the message out there.
Yeah.
This awareness to say, guys, the public, I think, for the most part, they have always known that, if someone were to collapse here at home or wherever, it's really on the shoulders of the healthcare providers. All I can do is really just call for help. And just calling for help, so people most of the time, because they don't know, they just call and say, someone has just collapsed. They can't even tell the person on the other end to say, what exactly are you saying?
Yeah.
So, so I want to be able to show them that there's actually a lot that you can do, just to bring that awareness to tell you, we can actually work we need you, for these people to be able to survive, and we have all this, ideas and programs that we can bring forth so that you can now start getting involved in this chains of survival for a lot of these emergencies.
I think on that note, especially, I think I liked what you said earlier, that most emergencies happen outside,
exactly,
right, in the community. And in recognition of August 31st, which is International Overdose Awareness Day, I think one of the most common emergencies, now that we're in September, Buipuso's coming, December, a lot of people tend to overdose unintentionally or intentionally, right? You have different things, for example, on opioids, on stimulants, depressants, which we'll touch a bit upon, but I think, can you just briefly tell us what an overdose would be?
So an overdose would be when someone takes more of a substance than their body can safely handle.
Okay.
If you take too much of something, your body has to be able to handle it. If you take something into your body, your body should be able to handle it. Right? Without failing or dysfunctioning. Right? If you take something and it leads your body to actually fail to handle it, right? In terms of maybe it can shut down or or malfunction or whatever, then that you can safely call that an overdose. Just taking more of something
than what the body can handle.
Exactly.
It's a very simplistic approach.
Yeah.
Are there any signs that we can, like, for example, let's say I'm in the community.
Yep.
Is there anything that could make me think this could be an overdose?
Yeah. They are those signs, but they also depend on what you might have actually overdosed on, right? Like you said earlier, there's a lot of things that people, especially nowadays, can overdose on. Prescription drugs, right? Like opioids. There's also stimulants, which mostly is illicit drugs. I think a big problem now that we are facing.
Also with the unemployment rate.
Exactly.
It's been a mess.
It's been a mess. Those drugs like cat. We also have stimulants, alcohol. It's also a big one. People can sometimes overdose alcohol.
I think you should repeat that again because it's something that people wouldn't typically think about, that you could actually overdose.
I think people overdose on alcohol a lot, man. Whether intentional or unintentionally. And I think maybe sometimes a lot of people handle the alcohol overdose in terms of like it doesn't really lead to you being in a hospital or dying, but people actually overdose alcohol a lot. And sometimes I think people also confuse overdose with abuse. Right? I think most of the time people, when we talk alcohol, we are mostly saying abuse. Right? But there is abuse and there is overdose. I think with abuse comes down to like a pattern, where you are drinking most of the time, right? When you're supposed to be at work, you're not going to work, you'd rather choose to go drink, or you go to work drunk, and things like, also drinking against medical advice, things like that, just basically not giving your body rest. And it might not have like immediate effects right there and there, but it does have long-term effects, especially on your health, liver dysfunction, and also can affect some parts of your life, like your social life. At work, people lose jobs because they abuse alcohol. However, with overdose, if you put a bottle of vodka here, a 1 liter bottle of vodka, and I just take all of it within the next hour or two. So
not a good idea.
A lot can happen after that. People pass out, people vomit, people get confused, things like that's an overdose. What we mostly call blackout. That's an overdose. You have actually overdosed on alcohol. So those are some of the signs. And, with opioids, I think a good thing about our country here, a lot of this like really dangerous opioids you wouldn't easily find or over the counter or on the street. They're mostly prescription drugs. However, if it were to happen, someone who has overdosed on an opioid, something like morphine, codeine. Like fentanyl in other parts of the world. Those are like really, really dangerous drugs. If overdosed, they can really slow down your breathing, or actually you can stop breathing. If you overdose on these drugs. And you can imagine, if you stop breathing here, that means your brain, your heart is not going to be getting any oxygen. You're going to go into a cardiac arrest and, eventually die if, we don't do anything, or if the overdose is not reversed. So those are some of the things that you could be looking at in terms of when it comes to opioids. And with stimulants, most of the time with stimulants, as you can hear the word, they actually throw you into an overdrive, right?
This is stuff like cocaine?
Yeah, cocaine or cat, like you said earlier. They throw you into an overdrive. Your heart rate can go up, your blood pressure, and this can lead to things like seizures, or people can actually experience stroke. Like your blood vessels, like
The
just
rupture.
rupturing, and because of this high heart rate, high blood pressure. So those are some of, and they can also lead to such confusion and all that. So those are some of the things that people can pick up. However, I think if someone is just not okay, you can tell. Right? You might not have an idea of what this could be.
But you can tell.
If I know you, Nelson, I'm always hanging around with Nelson. I know when he's okay.
Yeah.
And I can tell when there's a problem. And even if you don't know what the issue might be, the best, treat this as an emergency.
Right.
And, get help. Call EMS, whatever. You don't have to be sure about what's happening. If you see someone is out of character, this is, okay, I always go out drinking with this guy, but today, this guy is, he seems confused or he is passed out. There's a problem. And, you should get help immediately.
Speaking of help, because we've contextually explained what overdose is, right? We've touched on recognizing the signs. Now, what would be our first aid or immediate response? Like, okay, I see this person that's fidgety and hyperactive, and I assume that he's more active than he normally is. And upon hearing, I'm told that, okay, no, he had so-and-so. Or maybe, God forbid, let's say the person blacks out. What is my first response? I think you already spoke about EMS, calling them medical services.
So the most dangerous things that you should always be on the lookout for, by all means, get help, because you can see something is off, right? Second thing, check for things like, is this person breathing?
Yes.
Well, are they responsive? Are they alert? Are they conscious? Are they responsive when I call them or when I touch them? Right? Check for some of those things. Responsiveness, right? Check, are they breathing? Or is there a problem with their breathing? Is it slow? Are they gaspy, or is it shallow? Those type of things, And also check, do they have a pulse? Like,
How does one do that? How does one check the pulse?
So it speaks to why people need to get some of this, training. But especially for adults, if you touch this part of your neck, there's we call it the trachea. There's this hard part of your neck. Then take two of your fingers, slide to the side. As you slide down, you should hear a groove between this part and there's a muscle here. You should hear a groove. Slide those two fingers in there. You would feel a pulse, right?
What blood vessel is this? Huh? I'm saying, what blood vessel is for all our young science students?
This is the carotid. This is the carotid.
It's a very nice trick. This two-finger slide.
Okay. Put these two fingers here, then slide down. Okay. You should feel a groove.
Okay.
And this way we would mostly you'd feel a pulse. So these are some of the things so look for those things, because they are most, if you're not breathing or not breathing well, it's definitely, this is life-threatening. If you don't have a pulse, you're actually in cardiac arrest. If you are unconscious, there's a lot. You might be unconscious or unresponsive, but have a pulse and could be breathing. But when you're unconscious, you don't have a lot of control over your airway. It can actually get blocked, and you wouldn't do anything because your central nervous system is heavily suppressed. That's why you are just unconscious. Right? And you can actually vomit as well and aspirate in your vomiters, and some of those things can lead to respiratory failure, eventually cardiac arrest. So these are some of the things that you need to be looking at. And, if you see any of these signs, like we said, if you have some form of, basic life support training or first aid training, like if you don't get a pulse, you need to start CPR. You need to start those compressions. If someone is not breathing, you need to be able to, how can you try, if you feel like it's safe for you to do mouth to mouth, you definitely can do that. And if someone is unconscious, they are breathing, have a pulse, put them in recovery position so that, they don't choke on either vomiters or anything, right? So if they're in a recovery position, so you can actually maintain their area like that or protect it.
What is the recovery position?
Yes. So if someone is unconscious, you can actually, if they are lying down like this, you can have them be on their side.
To the side.
Right? You can take, let's say I'm lying down and you are on this part, on this side, right? You can take this hand and put it here and pull my shoulder and this leg to the side so that I am on a lateral position. Yeah. Then I'm gonna have my head is gonna rest on this hand, and this one will just be like free. This. That's how you can. That's the recovery position, and you can actually maintain someone's airway and protect it like that.
I like how it's a practical session as well. Yeah.
So it's like, these are like really simple stuff.
Yeah.
However, people just need to get this basic training, and you can hop onto YouTube if you want to learn more about the recovery position on how to do it. I know a lot of people have access to some of these things. So, but I'm a staunch believer and advocate for people getting proper structured training programs around some of these things.
So imagine a situation like that. Let's say it's a gathering, in the community.
Yeah.
Someone blacks out. Natural response is everyone panics.
Yeah.
In a panic situation, are there common things that people think they're doing to help that are actually mistakes?
Yeah. There's a lot of that, man. There's a lot of that. And panic usually is due to not knowing.
Yeah.
Yeah, that's really where it comes from. You would collapse here. People will start getting water, pouring water over you, hoping you wake up.
Yeah.
People shaking you, sometimes slapping you, hoping that you can wake up. But those are just they're just myths. They don't really help.
Really?
They don't.
The slapping and
No. The only time you should, it's actually not slap, it's tapping. Yeah, if you collapse and I want to check your responsiveness, I can just come and tap you on your shoulders and try to call you.
Right.
Yeah, and if you're responsive, I will see you respond, like maybe a facial expression or something. That's far as you can go. As for like slapping people, pouring water, sometimes people take they try to fan with maybe a box to give them a bit of like fresh air. Those things don't really help. I think we just really need to know why people would usually collapse. And once someone has collapsed, what are you seeing besides the collapsing? What are you seeing? Are they breathing? Those are the questions that you should be asking yourself. Do they have a pulse? Right? Because those things, with an emergency like a cardiac arrest, that is if your heart stops, you'll be unresponsive, you won't be breathing, you won't have a pulse. And this is fatal. This is really, you're just about to die. If nothing's not done in 10 minutes or less, there's like getting help, starting compressions, getting early defib, you're going to die. Yeah, that's for sure. You're going to die. So people need to get this training so that when someone collapses, they can actually tell. You can collapse for a whole lot of reasons, honestly. Not just because of a cardiac arrest. Someone can go into a diabetic coma, or they can faint due to fatigue and a whole lot of other
heat strokes and all that.
And you can collapse, have a pulse, still breathing, or maybe not responsive or slightly responsive. So people need to be able to tell these emergencies apart. They can only do that if they have some
the right
training,
knowledge,
first aid training, or emergency cardiovascular care training.
I think we've debunked a very interesting myth, the slapping people and the fanning.
Yeah.
I guess it probably feels good to be fanned, but I guess it has no ultimate effect.
Not when you have lost consciousness.
True that. Speaking of prevention now, right? And the role of the community in this. Is there something we can do as family members and people in the community to try and identify these things early? Anything that we can do proactively?
Well, So let's look at maybe why people, sort of like abuse or overdose, especially on things like stimulants or illicit drugs or alcohol, right? Most of the time it's because of like emotional, psychological stress.
Yeah.
Like you said earlier, people are unemployed. That's not nice. Relationship problems.
Jolo.
Yeah. I was actually speaking to emergency care physician the other day. He was telling me about like a lot of the overdose cases that they see coming into the emergency room. It's mostly women, and
true,
when you get to the bottom of these things, it's mostly like
relationship
related. So, so I think first let's learn to know, each other. Like if you see someone is not really good, reach out and try to find out, offer that support. And with that said, also let's also speak to the individuals, right? If you're going through something, learn better, healthier coping mechanism. You can never get any help from taking in any substance.
True.
That's just how it is. You're just gonna make things worse and throw your life into a down spiral, right? And even if it didn't have to be like that, so I think we just need to learn to deal better with, this, psychological or emotional stresses, and also even if you find yourself having, started some of the stuff, overdosing or abusing either alcohol or this illicit drugs. As families, let's see this more as a health issue, as opposed to a moral decay or failure, right? Because that brings about now the stigma.
Yep.
Even if someone is struggling, I think most of the people that do some of these things, they are not really proud.
No, they're not.
They are not. They at some point want to stop.
Yeah.
Right? Which means they need help. They need support. But if we stigmatize, that means they're not going to come to us for support and help. Right? So let's speak openly about some of these things and not, stigmatize or criminalize these things. Let's see this more as a health issue. Right, so that people can actually come out, and actually ask for help to say, hey man, I'm on this, and I really want to stop, because it doesn't really, it matters how you started, because in terms of let's get down to the root cause, not to sort of like scold you, why did you start this, right? We are here, you need help, and we need to support you. So I think let's look at why people go to some of these things, end up overdosing. And someone sometimes it's also just attention seeking, especially related stuff. Someone would take a pack of paracetamol, because they want to scare their partner, or they really just want to take, because they feel like they can't handle whatever it is that they're going through, so they just want to take away their life, and so let's try to deal better with these things as individuals, and also as families, as communities. Let's support each other. Let's not stigmatize. Let's not criminalize people within our families and communities around some of these issues.
I think that's very important, because the danger thing for me with overdose is, because remember how you said it's taking in more than what your body can handle.
Yeah.
You don't know what the limit is that your body can handle.
Exactly.
So it'll catch you off guard.
Exactly.
Unexpected.
Exactly.
And I think if we can have more open discourse within the family, let it be something that we can talk about, like you said, without stigmatizing and making people feel bad about it.
Absolutely.
But I think in touching with the whole community aspect, right?
Yeah.
I think my final one is, where can people reach you in terms of trying to establish these services or these programs? How can we reach you? Maybe an organization would like to have their employees have first aid training.
Absolutely.
I mean, that's what we're trying to do, is to have as many people trained as possible.
So we are currently able to offer a lot of these training programs for both healthcare professionals or healthcare institutions and the community through our company, Healthcare System Solutions. You can check us out on Facebook, Instagram, LinkedIn, and you can reach out also to us. Our email address is at ssetlare@healthcaresystems.co.bw. So if you want to learn more about these different training programs, reach out to us, and we can sit down and actually show you what we have available and how we can help you in that regard. And I would really like just to emphasize that, guys, it's important for us to get this basic training, first aid or emergency cardiovascular care training. It's and we see a lot of incidents happening. Even just outside overdosing, people are just collapse in workplaces, at home, and they don't survive because people around them, when these things happen, don't know what's happening or what to do. And I think it's very important. You never know. I might be a healthcare provider here. I mean, at home, well, if one of my kids or my partner collapses, I'll probably know what to do. But what if it happens to me, right? And everyone needs to be able. It has to be capacitated, right? My child or my partner should be able to save me because they can, if they have the awareness, they have this basic knowledge in terms of like, okay, how do I get help? In the meantime, what can I do? What do I think we have here? So that's why, our training programs can go down to family level, where, you can actually train yourselves within a family, at church, at work, because I like to say this, with a training program, it has to be scalable. It has to be easily accessible, and if I sit here and say, I will train you guys as a whole country, it's close to impossible, right? So we want to capacitate people to train themselves and their families and their friends and church mates. We have these programs even for schools, where these kids can be taught at school in terms of like, when this happens, what can you do, with a lot of these emergencies. So they can just reach out to us, and we should be able to offer them these solutions.
Yeah, absolutely. I think not only has it been very insightful for me, I'm sure for anybody that's watching.
Yeah.
I really look forward to the day that everyone in the country has at least a basic knowledge of first aid.
Yo, man, that is my dream. I think you can just imagine the impact that would have into our emergency response systems. That would, outcomes would improve. People would not die unnecessarily. A lot of deaths are avoidable, to be honest. And
a lot of them.
We'll put a stop to that because people know now. I can't wait for that day as well, man.
But once again, thank you so much for your time, for your input, Mr. Sokola, Mr. Tlare. Thank you.
Pleasure.
Thank you, Kalafhi Day Hospital, for the venue.
Absolutely.
If you have any more questions further than what we discussed, please feel free to reach out to us, and we'll touch base with it. Until then, no ameti, mind your business. See you on the next one.